Good morning, friends. My topic today for you people is emerging role of artificial intelligence in healthcare. Well, what is artificial intelligence? Artificial intelligence can be defined as the ability of a computer to comprehend data and come to a result which is agreeable by most of the people to be correct. So in other senses, the ability of a computer to mimic human brain in given fields will be artificial intelligence. So it is basically a computer only with a program fed into it, but it is mimicking brain. So what is artificial into this? Well, humans have taken a birth, their life. And artificial means all the things which have come and created by humans themselves. And what is intelligence? Well, intelligence means the act of being able to learn. This is a thing which is with the humans. They can learn with previous experiences, with reading, with hearing, and then come out with an effect. Reasoning. Reasoning is the other activity which is intelligence, where we can reason out why it is like this and not in the other manner. What will be correct? Third becomes that we listen to things, we hear the voice, we do speech recognition and come with a decision that this man was sorrowful, this man was happy, he is likely to be happy. And then finally, based on a lot of data, if the computer can give a decision that out of so many populations, this much percentage was suffering from malaria. So this zone is malaria with malaria. So that becomes a decision making. These capacities of learning, reasoning, being able to discuss, and the decision making are called as intelligence. And they are but for the humans, not for all the people. But then, these have been added to the computers in the form of artificial intelligence programs. So why was this term here? Well, in the early 1950s, in the year 1956, John McCarthy from USA in the Dartmouth conference gave this label as artificial intelligence. The term was very catchy, and so it took its place and continued. The early models, like there was the machine which calculated sums, minus and other things, is called as a calculator, but it was taken as an artificial intelligence model. And then it got so much acceptance that it's now easily present with all of us, and now we call it as a calculator. So any of the artificial intelligence apps, if they are accepted into the society and they are present at a mass level, they are given a name and put out from the artificial intelligence level. And the same thing goes with the fit belt that you are having. You can hear your heart rate, you can see your ECG, you can have your step count, balance, everything. So it is present in the form of a watch. It is being sold out as a watch and not as an artificial intelligence app, but that is into the market. So then, what is the role of this artificial intelligence in healthcare? Do you know what is health? Well, health is a state of complete physical, mental, social, and spiritual well-being. It is not just an absence of illnesses. And India being one of the highest economies, with the highest people to be given health care, there are problems which have been identified. These problems can be that there are very less trained healthcare personnel to take care of the health needs. This can be in the form of doctors, this can be in the form of technicians, lab attendants and others. So if we cannot have so many people, then how do we go for healthcare? It is simply that if we make AI apps focused to some particular areas, at least this need can be fulfilled. The second thing is, there is an unequal distribution of healthcare, where in the metros you can get a bypass surgery, you can get a heart transplant, you can get renal transplants. At AIIMS you can get this, it is difficult to get all these things at Jagdalpur. So it is really difficult. And here where, if you make an app, like we at AIIMS have also made, so they feed an ECG at Jagdalpur or Baladila, and the machine tells them, this is a heart attack, and you start with this treatment to save the patient's life. Meanwhile, having started the treatment, the patient's life is saved before he is shifted out. So this is a great boon. The third thing comes of affordability. India still having the maximum money is poor. People sitting in the villages cannot afford treatment. If you make costly artificial intelligence apps, it will become more costly. So we have to face this also by coming out with cheaper artificial intelligence apps. And finally, the health model that we follow is of reactive healthcare. What is reactive healthcare? Well, reactive healthcare means once an illness is there, we treat it. A patient gets diabetes, gets a kidney failure, we go for kidney replacement. A patient gets a heart attack, we try to treat, and then we go for heart transplant. A patient cannot breathe out of COVID, respiratory results are poor, we go for a lung transplant. You think how much is the cost? Because the illnesses are there, and when they come, we respond, we treat. Ancient India had a model in which we went for preventive care, maybe Ayurveda, maybe Siddha, and other patches. The aim was on making a patient strong, giving him yoga, pranayam, good nutrition, exercise, a good mind, and people used to stay more than 100 years old. But with this reactive model, we have to treat illnesses, and so the AI apps have to come in this direction only. So what are the artificial intelligence apps do in healthcare? Well, they can go for research, they can go for training, they can go for early detection of illnesses, they can make protocols for treatment, you can read the protocols and treat, you can go for treatment, you can go for monitoring. And the basis of making all these apps is data. So, management of health data of the whole country is very much required. You see, there are so many things, Abha IITs, other healthcare things, Ayushman Bharat Yojana, all the people are getting health treatment. But then the records are there. If you maintain the records, you will exactly get to know which illness is coming, in which group of people, at which place, at which age, and how much is the cost of treatment of a man's life. So it is very important. The problem with these systems is the data should be true. If we are taking data from the literature, we find there are articles with duplicate publications. At some places, people are doing data fabrication. They're making the data out of air. At some places, they are falsifying the data. So if the data is not correct, how will the machine work properly? And then, some people are stealing data. There is hacking and malwares available. People want to make the same machine with the data which is owned by others. So there are ethical issues. But at the end of the day, if we can have a data which is true, then you can come with an illness. I'll give a simple example. Suppose we want to diagnose a bone tumor. All we need is the patient age, sex, bone involved, site in the bone, type of destruction, pattern of destruction, and whether it is single or multiple. Now, once these patterns of destruction and periosteal reaction are taken on an X-ray and fed into the machine, based on the picture, it will tell it is an osteogenic sarcoma. And 90% times with the histopathology, it will be coming true only. So many people are coming out with apps which will give a diagnosis. But then the data has to be true, and the data of 10 patients or 15 patients or 20 patients is not there. It has to be lakhs and lakhs people of data. When the whole country will combine in making a registry and add data to it, then only it will be true. And this is what the government of India is in a process to collect from. The second way artificial intelligence can help is by digital consultations. UK had an app called as Babylon. It will do a voice recognition, it will register you, It will listen to the things, and based on the data, that these are the symptoms matching with this illness, will suggest you. Suppose it is headache, the app will definitely tell that if you have taken food, you are an adult, then maybe 500 milligram of paracetamol at this juncture will be good, but don't go beyond it. So these type of consultations digitally are always available, and WhatsApp video is one of that which people are performing. But with WhatsApp video, the treatment is being given by a human being. Artificial app means you tell your symptoms, it will tell you. It appears to be uncontrolled diabetes, and you have to start with this diet and go for the treatment. So that will be an app which will act as the human. That is what is artificial intelligence. Then there are so many activities like making slides, doing blood investigations. Thousands of people are giving blood samples at AIIMS, and the technician is doing it. Think that every time he has to take 0.5 ml of blood for 1,000 samples. Will it be possible? He may lose interest. He may start using AIIMS. He may start using WhatsApp. He will see Facebook. He wants to take rest. So these human errors which will be coming can be taken care with an artificial intelligence app, which will be totally precise and accurate, and the sample taken will be exact, and the reports will be exact, and every time you do it, they will be precise. So this is one of the activity which comes with the artificial intelligence apps and has been utilized not from now, from the early 90s till date. New and new auto analyzers are coming in the field of pathology, in the field of radiology, in the field of anesthesia, in the field of gynae, surgery, and different type of systems. People sometimes feel that automation, robotics, artificial intelligence, all are one and the same thing. But it is not true. I'll give you a simple example of what is automation. Suppose you are having a tank at your home. Once it reaches a certain level, the water goes, the machine gets off. Once it comes down, machine again starts. It goes. It doesn't need any brain or decision making. That is automation. What is a robot? So it is a computer which has been programmed to do a work. And then it does the work, but doesn't use the brain. But you can put artificial intelligence in a robot. So he starts thinking that if the levels of this data is here, I will do this activity, and with this data is of that much, I will do that activity. You must have heard that at the time of COVID, multiple hospitals had got with them a robotic nurse. So that was a robot. Once you switch the button, it used to go to each and every bed and timely give the drugs, which were put in packets for the patient to put it up. Now think of a condition, the patient is in a very great sorrow. He is sinking. He needs support. But this nurse will not hold his hand and speak to him. The nurse will not do anything. So the part of empathy, that is lost. The feeling that he is a patient. If I was a patient, what will happen to me? What I need is what is needed by this patient. So a robotic nurse cannot give you an empathy. At times, you want people to support you, and that does not come. So there are some shortcomings coming into these things. At times, the healthcare workers feel if artificial intelligence will take away all of our work, then we'll become jobless. How will we earn? So when the machine has been made by humans, it is in the control of humans. Nobody can take away your job, and you should not be having an apprehension, but that apprehension is there. Remember, any artificial intelligence app or robot has got a power button. It can go on, it can go off. You can erase the memory, you can add the memory, you can make it up to date. But the humans, they have got the brain, which are supposed to act lifelong. Then you can go for designing treatment protocols. You can go for starting the treatment. You can see to it that this old age man, whether he's eating the tablets or not. So if you have given him a mobile, the photo will come. He'll put the program. He'll be very sure, today I have done compliance to the treatment. I have taken this drug. For our tuberculosis control program, This has been a great fight. People are not compliant because of they have to take the same drugs for 1.5 years. And what happens? They forget whether they took it or they did not take it. So, artificial intelligence apps help in this field also. There are fields of new drug discoveries. If you have got the chemical structure and formulas of the previous drugs where they were used, you see what happened in COVID era. Remdesivir, which was used for Ebola virus, could be traced and used in COVID-19 also. So newer drug discoveries can be made with the help of artificial intelligence apps. Health monitoring, we all know, is definitely there. And I told you about the belt, I told you about different apps, I told you about the machine which sees whether your sugar is going in what way, your heartbeat isn't going way. And people are using it regularly. Some of these are going out of the area of artificial intelligence. DEXA checks bone density. Now it is a costly app, and even if it is not costly, it brings about radiation. So we are in the process of taking simple X-rays of the pelvis and comparing it with DEXA, say 15 to 20,000 of the patients, and we'll compound with the app where we will focus the X-ray machine, and you will get to know this much is the density. So efforts are there and people should go with it. Now just think of a robot with artificial intelligence who is doing surgery. Accidentally, this surgery fails. The family says, we went to a big hospital, it had a robot, surgery failed. The question comes, whom to sue? The person who made the program, the person who sold the computer, the person who has purchased the robot to use, or the surgeon who had counseled you. So regulations have to come in place to take care who will be fined or made responsible when a robot does the wrong surgery. It is very important. What is more required is, this is also not clear that if you find that the robot is doing wrong, can the doctor automatically switch it off and start doing the surgery? People may say that the robot was doing good and you were doing wrong. So these things, these litigations, these rules have still to be formulated, which have to come. And finally, you must have seen the new movies in which Kirti Sanan becomes a robot, starts to love, and then manages to continue with the love, being a human being. That is the deepest form of artificial intelligence, but that is yet to develop. There was another movie, Robot. In the third movie recently coming, there was a robot girl which the scientist had made in the form of his daughter, and which was fighting for the country, fighting the enemies and being successful. So we have to think over these things, but currently artificial intelligence is limited to a computer which processes a lot of data and comes to a conclusion which is agreeable and has been agreed to upon a group of scientists, and the machine is made and a beach approved. Thank you.